Hello, I'm Sophie Scott. Welcome to HealthWatch. New research has cast doubt on whether people should take calcium supplements to ward off the degenerative bone disease osteoporosis. Doctors advise people who don't get the recommended daily intake of calcium in their diet to take supplements, but a review of studies has suggested it could lead to an increased risk of heart attack.
Like many women concerned about their bone health, 44-year-old mum of three, Sandra Holland, takes calcium supplements.
Busy day, busy mum, I don't have time to, always look after my diet.
But new research from the University of Auckland has raised concerns for those who take calcium supplements. After analysing existing data on almost 12,000 adults who take the supplements, researchers found their risk of heart attack increased by up to 30%.
It is raising our awareness that perhaps there can be unwarranted side effects of taking too much calcium.
But experts from Osteoporosis Australia have cast doubt on the findings.
The method of determining whether these people actually had a heart attack often relied on patients' self-report. And patient self-report is notoriously unreliable.
The organisation also says the study did not look at patients who took calcium supplements in conjunction with vitamin D, which helps with absorption. Osteoporosis Australia says it will rethink its guidelines around the use of higher doses of calcium supplements, but it says the study does not provide sufficient evidence to suggest that older people with osteoporosis stop taking the calcium supplements altogether. Sandra Holland says she's not concerned about the findings and will continue taking her calcium supplements together with vitamin D.
I want to stay active, I want to stay upright, and I certainly don't want a hip replacement, when I'm 60.
Experts agree that a calcium-rich, balanced diet, combined with regular exercise in the sunshine, is the best way to look after your heart and your bones.
A South Australian health organisation has found that problem gambling affects Aboriginal people more than the general community, but a new approach to therapy is proving successful.
Don Hayward lost hundreds of thousands of dollars in the 18 years he was addicted to gambling. His marriage broke down and he lost friends' trust because the longer he gambled, the more he lied about it.
It destroys your life. It takes away who you really are, so it has done a lot of damage to me.
For problem gamblers, what starts as fun can soon become an obsession. Researchers say problem gambling in Indigenous communities is a significant mental health problem, along with alcohol abuse and nicotine addiction. They say pokies are stripping Aboriginal communities of money they don't have.
Because people are unemployed, they've got less money to play with. And so when they make a choice about what they're going to spend their money on, often it's gambling, smoking, and then maybe food.
Research into problem gambling among Aboriginal people has been limited because for most gamblers, talking about their addiction is the hardest move to make. But South Australia's statewide gambling therapy service is making headway. It's trialling an approach which sends therapists out to Aboriginal communities to help build trust with gambling addicts.
Because at the end of the day, you can have gold standard treatment, but if you can't build effective relationships between the therapist and client, you're not going to get good outcomes.
In the past year, more addicts have been treated than in the previous 10 years.
It's like you get your own life back again. Now I'm able to do things and not feel guilty or not lie to anyone.
76% of clients who completed treatment have fully or substantially reached their goal.
And doctors say they've used a genetically engineered herpes virus to successfully treat patients with head and neck cancer. In a London hospital, a trial on 17 patients found that the use of the virus alongside chemotherapy and radiotherapy helped kill the tumours in most of the patients. That's all for HealthWatch. See you next week.